Hello, good afternoon, everyone. Welcome. It's nice to have everyone join us today. I'm Holly Hankinson. I'm the Advocacy Director for the Women's Fund of the Greater Cincinnati Foundation, and I want to welcome everyone and thank you for joining us to our webinar. We are releasing our latest research today, examining the impacts of the Earned Income Tax Credit. Go to the next slide. So here's our plan for the day. We'll start with a brief introduction to the issue, and then I'll turn it over to my colleague, Dr. Travis Spies, who will provide a deeper dive into the research and share highlights from our report. Next, we will hear from our featured guests, Alexandra Haralampudis from Prenatal-to-3 Policy Impact Center and Matthew Long from United Way of Greater Cincinnati. And we'll end with some time for Q&A. Please feel free to put any comments or questions in the chat as we go. And be on the lookout for an email with the complete research report after the event. And so with that, let's get started. First, I want to share a little bit about our organization. At the Women's Fund, we are designing a community where all women can participate, prosper, and reach their full potential. Our mission is to advance gender and racial equity for women by addressing systemic barriers to upward mobility. And we do this through our success equation, which you can see here on the screen in circle. First, we assess the status and identify opportunities through conducting research. We prioritize original research that's disaggregated by race and gender. Then we catalyze the community by producing messaging and tools for multiple stakeholders to own and address the issues, building a common agenda with key partners and inspiring the public to support and promote our work. And our ultimate goal is to drive systemic change through conducting policy advocacy, increasing the number of women at decision-making tables through our civic engagement work, and innovating and incubating projects that improve self-sufficiency, such as our employer toolkit. Through this work, we believe we will see improved conditions for women to achieve self-sufficiency in Greater Cincinnati. Next slide. So that's a bit about our organization. As you know, today we're focused on the research portion of our work. We're going to start with a brief history and understanding of what exactly is the EITC. So the EITC in general is a tax credit for working individuals, with the greatest benefit going to families with children. It offers an opportunity for individuals to receive an annual credit while filing their taxes. Note that this is different than a tax deduction, which reduces the amount of taxable income someone has. A tax credit directly reduces the amount of taxes owed, so it's money directly back in the pockets of recipients. The Earned Income Tax Credit began as a federal program in the 1970s to offset rising costs of food, energy, and Social Security payroll taxes. Since then, it's been expanded under both Republican and Democratic administrations. And because it incentivizes work as an alternative to welfare, it's widely recognized as one of the best anti-poverty measures in the United States. Many states, including Ohio, supplement the federal EITC with a state-level EITC, and this is usually offered as a percentage of the federal credit. So this chart demonstrates how the EITC works and some of the values of the federal credit. As you can see, while small credits are available to working adults without children, that's the blue line in the bottom left corner of the graph, the larger credits are offered primarily to working parents. The size of the credit depends on the number of children and income of the individual. As income rises, it's also structured to phase in, plateau, and then phase out as income continues to go up. The phase-out period is more gradual than the phase-in period to allow for a more stable pathway out of poverty. For example, a parent with 2 children making $21,000 per year will receive a federal tax credit of about $6,600. The credit is offered as a one-time lump sum each year after an individual files their federal income taxes. And at the federal level, the credit amounts greater than the total amount owed in federal tax are refunded directly to the taxpayer. So as I mentioned before, many states offer their own credit based on the federal program. There are a total of 31 states with an EITC program. Here, this is our sort of neighborhood in Ohio. The green states offer refundable EITCs at varying amounts, from 6% of the federal EITC in Michigan all the way up to 34% in Wisconsin. The purple states have no state-level program at all. Ohio, right in the middle in red, currently has an EITC worth 30% of the federal benefit, which is a pretty significant percentage. However, Ohio is one of only 4 states in the country with a non-refundable program. And here's why that matters. A non-refundable credit reduces the amount of state tax a family owes, but it cannot exceed their total tax liability. As a result, families that pay little or no state income tax do not receive the full benefit. Making the credit refundable would allow families to receive the full amount regardless of whether they owe state income tax. It's additional money in their pockets. Now that we have a better idea of what is an earned income tax credit and the different types, I'm going to turn it over to Travis, who will talk about the more specific impacts of the EITC.
Thank you, Holly, and good afternoon, everyone. I'm really pleased to be presenting to you our latest research report from the Women's Fund, Benefits and Costs of State Refundable Earned Income Tax Credits. The Women's Fund has been doing research on women's economic mobility for nearly 20 years and has been a foundation of our advocacy efforts. Reports on pay equity and cliff effect have led to policy changes that promote the self-sufficiency of women and families. Our work on the cliff effect in particular has guided the way that we think about the importance of being self-sufficient. The cliff effect is when an individual receives a small increase in income that results in a net loss of financial resources due to now being ineligible from certain types of public assistance. The chart here shows an example from our 2020 research report on the public benefits journey for a one-adult, one preschooler household in Hamilton County, Ohio. So you can see where these cliffs occur. As the annual earned income increases, the total gross resources, that black dotted line here, remains relatively flat due to social assistance programs phasing out and declining in benefit dollars provided. Being cut off of these kinds of assistance programs, things like childcare, healthcare, and others, is what prompted the Women's Fund to learn more and ask ourselves, how or where are there opportunities to soften or eliminate these cliffs? How can we ensure that women and families have opportunities to be upwardly mobile and achieve self-sufficiency? We identified the Earned Income Tax Credit as one of these opportunities to reduce the cliff effect. Holly's already mentioned the difference between federal and state EITC programs. And while many states have transitioned from a non-refundable EITC to a refundable EITC, Ohio has maintained its non-refundable tax credit. The Women's Fund has reviewed much of the available literature to better understand both the benefits and the costs of refundable EITCs. Many studies have documented the positive outcomes of refundable EITC programs. The credit has been linked to numerous benefits for individuals, children, families, and states. And while the non-refundable EITC programs can alleviate some of the financial burdens that low-income workers face, the evidence demonstrates that refundable EITC programs have even greater benefits for everyone. Because the EITC is received primarily by working individuals with children, there are multiple benefits for families. Most notably, the credit improves financial well-being. Because the value of the credit initially increases as individuals earn more, there's an incentive to work. Research shows that the increases in employment rates for single mothers are particularly significant. Annual employment increased by nearly 9% over a 12-month study period. And with increased employment, we see measurable increases in household income, particularly for women between the ages of 19 and 35. Additional studies have demonstrated that a decrease in poverty, increase in wages, and an overall increase in opportunities for self-sufficiency. Unlike some forms of public assistance that are viewed as kind of band-aids, the refundable EITC has proven to be a long-term solution, providing a more permanent pathway out of poverty. individuals and their families also benefit from improved health. With reduced worry regarding finances, individuals report decreases in stress and other mental health problems. Other studies find that mother and child health scores improved among EITC recipients. And finally, maternal smoking also decreased among EITC recipients, creating a healthier environment for all household members. With improvements in parental health, parents are able to better care for their children's needs, benefiting the whole family. And now, in addition to financial and health benefits of the EITC, there are also social benefits that support families. In a study interviewing 30 low to moderate income single women with children in the Midwest, researchers found that the EITC acted as a strengthening agent among caregiving networks, particularly among extended family and fictive kin relationships. And going further, state-level EITC programs are responsible for decreasing foster care placements by more than 7%. Reducing financial strain really has tremendous positive outcomes for the whole family. When parents receive a refundable EITC, children benefit in specific ways. EITC programs are one of the most effective anti-poverty programs for children, just as they are for adults. In fact, when compared to other forms of assistance like SNAP, TANF, and child tax credits, the Earned Income Tax Credit is more effective in reducing childhood poverty. And states with refundable EITCs have experienced a 40% greater reduction in child poverty compared to states without refundable state EITC benefits. And this is important because we know that children's early years are so important for their healthy development. One of the most important factors in predicting a newborn's health is birth weight. Low birth weights resulting from poverty are associated with a range of potentially long-lasting negative consequences affecting children's life chances, such as increased infant mortality, poor childhood health, and lower educational attainment. Recipients of refundable EITC credits are more likely to have healthier pregnancies with longer gestation periods, higher birth weights, and decreased infant mortality rates. These positive outcomes for infants follow them later in life as well. Access to refundable EITCs are associated with decreased childhood obesity, improved overall health, and reduced instances of child maltreatment and neglect. Not only does the EITC lift children out of poverty and improve their health, this credit can set children on the path towards economic self-sufficiency early on. In states with refundable EITCs, students have higher test scores. They're more likely to complete high school and college and are more likely to enter the workforce. And when they do enter the workforce, they tend to start at higher wages compared to entry-level workers in states without a refundable EITC. Now, this program is intended to aid working families, and the majority of the benefits naturally go directly to individuals and their families. But the EITC also benefits the state in several ways. I've already discussed how a refundable EITC has the effect of increasing employment. Because the value of the EITC initially increases as workers earn more, there is an incentive for individuals to work. So while this is great for individuals, states with refundable EITC programs benefit from lower unemployment rates and a more engaged workforce. Federally, EITC expansions have been shown to increase the labor supply, particularly for women with lower education levels. This increase in labor force participation has been noted since the federal EITC's introduction in 1975 and after each expansion in 1986, 1990, and 1993. With more eligible workers employed, state economies have more opportunities to grow. In addition to growing economies, states see lower poverty rates and have fewer residents living in severe poverty. This means that more of the state's population is likely to be self-sufficient and has lessened need to rely on public assistance. Specifically, EITC programs are associated with a decreased reliance on public health insurance and an increase in private health insurance. And when we look at benefits taken together, research shows that there is between a 1.5% and 3% decrease in public benefits reliance for each $1,000 increase in the maximum EITC benefit, depending on the age of the family's oldest child. Lastly, this program nearly pays for itself since there is a lessened reliance on other public benefits over time. Research has shown that for every dollar spent for the EITC program, the net cost to the government is just 17 cents and is associated with a 69-cent decrease in other public benefit spending. Think of it this way. Taken together, the EITC program is less costly than school and breakfast programs, school lunch and breakfast programs. And all of these positive effects are long-lasting. Studies demonstrate that a decade after EITC programs are implemented, employment rates remain increased, and poverty and public assistance reliance remained decreased. So far, I've been focusing on all of the benefits of a refundable state EITC program, but I do also want to mention the costs of this type of program as well. As with any tax credit, there is an impact on the state budget. However, as I mentioned, the program largely pays for itself through a reduction in reliance on other public benefits. In 2022, about 877,000 individuals claimed the EITC on their 2021 tax return, receiving an average federal credit of $2,410. If Ohio had a 10% refundable EITC, the average household would receive $241. In total, the Center on Budget and Policy Priorities estimates that a 10% refundable EITC would cost Ohio roughly $229 million. However, because Ohio already has a non-refundable EITC worth 30% of the federal credit, the added cost of making the credit refundable would be lower, around $206 million, according to calculations based on the fiscal year 2024 tax expenditure report. And now, as a reference, Ohio budgeted nearly $18.6 billion for Medicaid healthcare services in fiscal year 2024, but they only used about $17.5 billion. I'll wrap this up with some final thoughts before I turn it back over to Holly. With a nearly 50-year history of wide recognition as one of the most effective anti-poverty measures in the United States, the Earned Income Tax Credit is a highly effective program that lifts millions of people out of poverty each year. At both the federal and state levels, EITC benefits encourage participation in the workforce, increase household incomes, increase educational attainment, improve health outcomes, and decrease reliance on public assistance. And to reiterate, while Ohio currently has a generous 30% non-refundable EITC, research shows that small refundable credits are better than large non-refundable credits. And Ohio is one of only 4 states that have a non-refundable EITC. Thank you.
Thank you so much, Travis. That was fabulous information. Next, I would like to introduce Alex Haralampudis to talk about her research and work on this issue across the country. Alex is the Director of Data Analytics at the Prenatal-to-3 Policy Impact Center. In her role, she oversees all processes for data collection and analysis at the center. Her career in applied research and program evaluation has focused broadly on the impacts of programs and policies on families living in poverty, often leveraging multidisciplinary and cross-institution collaborations to produce actionable findings. Alex earned a PhD from Rutgers School of Social Work, where her dissertation research focused on the impact of state tax policies on families' well-being, applying advanced training in methods for causal inference to several nationally representative data sets. So with that, I will turn it over to Alex.
Thanks so much, Holly. Thank you all so much for joining us today. Taxes, as Holly alluded to, are like my favorite thing. So I'm really excited to be here and talk about what is really important for many families across the country, and that's the Earned Income Tax Credit, and specifically state earned income tax credits. It's my privilege to be the director of the data and analytics team at the Prenatal-to-3 Policy Impact Center. If you could advance the slide, Travis. Thank you. And we are a research center at Vanderbilt University, and we're working to help states implement really evidence-based policies to that help children and families thrive from the start. Slide. And this is with a recognition that the first 3 years of a child's life are especially crucial. It's a period of rapid development, and it really sets a foundation for the life course, as Travis was talking about. And we, see time and time again in benefit cost analyses that we do that when you invest in early childhood, you really see dividends of that investment, because they multiply across the children's life. So we take a really holistic view of child development that's informed by the science of the developing child, and really look at kind of the system of care that states set up, everything from healthcare to early childhood education, and really monitor these 8 goals, we call them, but really the things that need to be in place to help children thrive, right? Access to the services they need, support so parents can work, resources at home, healthy and equitable births. So we review thousands of studies at this point, and we look at all the new studies that come out and examine the relationship between state policies and these policy goals. Slide, please. And we've identified 4 policies and 8 strategies, which are just ways that states can implement programs or policies where there's evidence that it supports these 8 ways that help children thrive. Slide, please. Thank you. And so the policies that we've identified, and we only use the most rigorous causal evidence, right? So these are studies that we feel are done incredibly well. The evidence is very strong that there's a relationship, that this policy improves this outcome that is going to help children and families. So that includes expanded access to Medicaid, paid family and medical leave, a state minimum wage of at least $10 an hour, and then, of course, what we're here to talk about today, earned income tax credits. And as Travis was mentioning, it's really a refundable state earned income tax credit that has these positive effects for children and families. And really what we see in the literature is and have set a threshold of at least 10%, right? So in tax year 24, for a family with 2 children, a refundable state EITC of 10% of the federal credit is about $700 for that family paid out in that one lump sum, assuming they don't owe any taxes. And we see that, state earned income tax credits are associated with, as Travis said, an increase in parents' ability to work, more resources in the home, and more healthy and equitable births. Slide, please. And because Travis set this up so well, I can just really quickly say, and this is multiple studies, right, establishing these relationships between state EITCs and these outcomes. Slide, please. And that is also outlined in our evidence review. The other thing I'll point out is that in our clearinghouse, we have evidence reviews for all of the policies in our roadmap, and also policies that they need further study. They haven't quite past that threshold of being an evidence-based study. So as you think, about policies and the potential in Ohio and what the evidence is for them, that is a resource that's certainly available to you. Slide, please. So as Travis said, there's 31 states with a state EITC. Only 23 of those states meet our threshold of having a refundable EITC of at least 10%. Montana will be a new one this year, which we're all very excited about. They recently expanded the generosity of their program. Slide, please. And, there's a rich history of state EITCs, right? Dating back to Vermont in the 1980s, with states increasingly adopting this, and not only adopting it, expanding their programs, right? And states continue to do so. And this history is what allows us to have this big body of research to say, what are the effects of this program, right? Things that are newer, like a lot of people are following like universal basic income, those newer policies, we just don't have the evidence base for that we do for the EITC. So because this program has been around for, over 40 years now, we really know the effects of the policy. Slide, please. So the EITCs vary a lot from state to state, right? And so one of the ways they vary is in their generosity and their refundability. So generosity varies from, Montana's going to go to 10% this year. So Wisconsin is kind of low, 4%, all the way up to District of Columbia, where they're giving 70% of the federal benefit to people who claim the credit. And those are all refundable credits. We do have the states like Ohio that have the non-refundable credit, which means that families don't actually get cash in their pocket as a return, right? It just brings what they owe to $0. And then we have states with no state EITC. And then we also have, the states that don't have an income tax and also don't have a state EITC. We are seeing some interesting movement in those states. So in Washington state, even though they don't have a state income tax, they now have an earned income tax credit like rebate that families are receiving. Interestingly, the idea was also floated in Florida during this legislative session. So there is just a lot of interest across states in this country around earned income tax credits. Slide, please. Again, just showing among the states with an EITC what this distribution of generosity looks like. And Ohio having a more generous non-refundable credit, but again, families aren't really receiving a ton from that. And you'll see that in a simulation I'll show you in a little bit. Slide, please. Now, in addition to variation in eligibility or in generosity and refundability, we see a lot of variation state to state in who can claim the EITC. So in 8 states, younger tax filers, that's filers in their late teens, early 20s, can actually claim the earned income tax credit. In 11 states, ITIN filers, which are individualized taxpayer identification number. So they're not filing their taxes with their social security number. They're filing with an ITIN number, can claim an earned income tax credit. And then finally, in DC and New York, non-custodial parents can claim the earned income tax credit as if their non-resident child is resident. In Illinois, older taxpayers, those 65 and older, can claim the earned income tax credit. And in Massachusetts, survivors of domestic violence who are married but filing separately can claim the earned income tax credit. All of kind of what we view as like the important considerations when you're thinking through a state earned income tax credit policy are laid out in our state policy lever checklist, which is available on our website. Slide, please. So now turning to some research and simulations we've done of the earned income tax credit. We conducted a benefit cost analysis of the earned income tax credit of a potential state earned income tax credit in Pennsylvania. And what this benefit cost analysis does is really look at the huge body of evidence on an earned income tax credit, right? All of these studies that Travis outlined, and say, okay, let's apply this to the case of Pennsylvania, and let's put some dollar values on these effects and compare what the cost would be to implement the program in Pennsylvania with the benefits we'd expect due to people entering the workforce, costing less for the health care services we're providing them, and all of these benefits. And this is a really great comparator for Ohio for a few reasons. And, yes, they are your next door neighbor, right? So they're a good comparator in that way. But the other way they're a good comparator is because Pennsylvania has what they call the special provision for taxes. And that is basically a program that allows the lowest income Pennsylvania residents to not pay taxes, right? It makes their tax liability $0. And that functions in a similar way to a 30% non-refundable EITC that you have in Ohio, right? So in some ways, this is a good test case for some benefits that we could see in Ohio with a refundable EITC. So when we do the analysis, we find that both a 10% refundable earned income tax credit or a 25% refundable tax credit in Pennsylvania pays for itself, right? The benefits outweigh the costs significantly, right? So the bottom line here, 7-to-1 benefit to cost ratio for the 10% refundable credit and a 3-to-1 benefit to cost ratio for the 25% credit. We've also conducted this analysis for South Carolina, and the results are very similar. Next slide, please. So I'd like to just wrap up today and share results from what we call our policy impact calculator. And so what this does is examine a household with a minimum wage earner in every state across the country and compares the minimum resources they'd have to provide for their family. So we consider earnings from the state minimum wage and paid family leave where those benefits are available, out-of-pocket childcare costs, and we assume that the family receives a subsidy, nutrition benefits from SNAP and WIC, as well as federal and state income taxes and credits. Slide, please. So we call our household, we call the mom Lena, and we assume that she's a single mother with an infant and a toddler, and that she works full-time, so 40 hours a week, at a minimum wage job all year. And we assume, and this is the biggest assumption we're making, is that she is receiving every benefit she could possibly be entitled to, right? And filing her taxes correctly. We also assume that she's taking 12 weeks of FMLA leave following the birth of her infant, and that her children are lucky enough to get a childcare subsidy and may go to care at a center which prices the care at the 75th percentile of the market rate. Slide, please. So this is super colorful, but this is what Lena's household resources look like in all 50 states and DC. And what I really want you to take away here is that there's huge variation, right? In DC, Lena would have nearly $49,000 to provide for her family. And then, number one. And then at the bottom in Georgia, Lena would have just over $20,000 to provide for her family. And, a lot of people say, oh, wait, it costs different amounts to live in these states. And that is true. But even when we adjust for differences in cost of living, these differences remain very stark. And you'll see Ohio there, where Lena would have almost $36,000, kind of middle of the pack, ranked 28th. So, we can do this thought exercise and say, how would Lena's life change with a 10% refundable EITC? Next slide, please. And you'll see that, it provides an additional, $650 in tax year 23 for Lena, right? But it moves you up the rank in our policy impact calculator from 28th to 24th. Ranks are funny things in a lot of ways. We can talk about that during Q&A, but you can also think about it in other ways, like half a month of rent, right? In most metropolitan cities in Ohio, or 7.5 months of diapers for Lena for her kids. So it really is providing crucial resources for families. And, some of the research that Travis was talking about, it's a lot of great qualitative work that just shows how crucial these resources are for families and how they use the money to invest in their children, and the money, a large proportion of it goes back into the local economy. And just a really quick plug, everything I'm showing here is from our roadmap last year, and our big release is in October. So all of these resources will be updated in the coming weeks. So you can check them out when they're updated online, and also join us for our our Research to Policy Summit on October 22nd. Thank you guys so much.
Thank you so much, Alex. That was some really, really critical data. We really appreciate all the work you all do to lift this issue up, and others across the country. So thank you so much. Next, we're going to hear from Matthew Long, who will share with us how this issue impacts families in Ohio. Matt has been with the United Way of Greater Cincinnati since 2021, having worked in the social service and higher education sectors for 17 years. He's the senior manager of the Community Impacts Program Management Team and oversees initiatives rooted in economic stability and community well-being. He supports United Way's housing security and financial empowerment focus areas. Matt can speak to the ways in which United Way remains responsive to families' immediate needs while also supporting strategic initiatives that promote long-term stability. Matt holds bachelor's degrees from Indiana University and completed his master's at the University of Georgia in 2007. So with that, I will turn it over to Matthew. Welcome.
Thank you very much for having me here today. I'm going to kind of start just first by kind of doing a little bit about United Way and then kind of drill down further a little bit more into what we actually do in terms of our financial empowerment work through taxes, and then share a little bit more information about what the thrust of most of today's talk has been, and that is the earned income tax credit. And I really would like to thank my esteemed and learned colleagues on today's call, because I learned a lot during this call as well. We're usually kind of more in the people service of some of the work that we do with EITC. So it's great to be able to get this information just to understand it and understand what's going on in other localities in terms of earned income tax credits. So just to introduce, at United Way of Greater Cincinnati, we fight for the economic well-being of all people in Greater Cincinnati, so our entire community can thrive both now and in the future. And at the United Way, we have three focus areas in which we've done a lot of investment, and where most of our work focuses on. One of those areas is housing security, which I actually helped to co-lead with one of my colleagues here at the United Way. Another area is educational success, with particular emphasis on early education and pre-K readiness, and then also financial empowerment, which will be the focus of today's discussion. So with that, we can go ahead and move to the next slide, because through financial empowerment, as well as our other three focus areas, we're taking three strategies to heart as we're working, and that is our investments in programs that are lifting up financial security, lifting up housing security, and preparing individuals through education. We're not only investing, but we're advocating, and today's talk is a lot about the advocacy. We've been strong proponents of the work that's been done in the state of Ohio to put forth either state child tax credits or earned income tax credit changes, as well as then action. So I'm really going to talk a little bit more about our action and what it is that we do in some of this space and how it relates to the earned income tax credit. So United Way of Greater Cincinnati is one of the VITA, or volunteer income tax assistance programs, that exists nationally. So if you're unfamiliar with VITA, VITA actually came about or was created by the federal government just actually right before the time of the implementation of the earned income tax credit at the federal level. The idea behind VITA is very simple. There's this belief and theory that individuals have right, or a kind of an owed benefit to being able to access tax preparation. And throughout our talk today, there's been a lot of evidence about who the earned income tax credit benefits the most, and it is those individuals who tend to be in the moderate and lower income brackets, particularly those of working families and working families with children. That's kind of, though, the interesting part about it is that those are the families that benefit the most. But then there's also, when we think about tax preparation, there's always a cost most of the time to tax preparation. And so VITA is kind of like one of those complementary programs that exist to ensure that individuals who maybe are in that low and moderate income bracket can actually access reliable and, kind of rigorous tax preparation without needing to pay a lot of money for that. And so that's what we do here at United Way of Greater Cincinnati. We run the local free tax prep initiative, which is our own local moniker for VITA operations here. So we are a network of about 450 volunteers that operate across Hamilton County, into Butler and Claremont counties, as well as into Southeast Indiana and Northern Kentucky. And through this network of volunteers and participating partner sites and host locations, where we have almost 30 locations where individuals can come and have their taxes completed by certified IRS volunteers with the United Way, that every year we make substantial accomplishments when it comes to the reinvestment of dollars back into our community and getting dollars back into the hands of families. So in this past tax season, which was the 2023 tax year, this 2024 calendar year, we know that we have helped individuals and families reclaim about $9 million in refunds. And wow, that is a really important number because that's about $28,000 per volunteer, meaning volunteers actually helped individuals bring back about $28,000 per family into this community. I think the two other things that are worth note is, what did we save families by actually providing this sort of service? We save about $2 to $3 million just in filing fees alone. So that in and of itself is a substantial return back to our community, that individuals are not paying for these sorts of tax services that they have access to through VITA programs. And locally, when it came to our own earned income tax credit, which I should say is the federal tax credit, we helped families through our tax preparation claim almost $2.5 million in earned income tax credits at the federal level. And obviously, because we have a non-refundable state tax credit, there's nothing that we can really report on that side of things. So if we want to go ahead and go to the next slide, this kind of slide really just kind of highlights a little bit. I know the text is a little hard to read. You might have to get the binoculars out to be able to see it, but this is really indicative of the sort of impact that the earned tax credit can have on families. Now, this is an example of a family that came to one of our sites over in Madisonville. It was a married couple. They had children, and they were of moderate income status. And so by kind of engaging in our services, what I think this is really, this story really tells is not only what the benefit of the earned income tax credit is, which if you kind of see that sort of fourth little line there, they got $5,000 back. $5,000. That could have been 5 months of rent payments. That could, I mean, that can be a lot of things to this particular family. S- Clothing for their kids, food for their kids to be able to make it through another quarter's worth of work. But I think it's also indicative of the work that this family actually came to a site planning on filing under a different status, specifically married filed separately. And it was through our work that we really helped to identify that in doing that, that would have limited the benefits that they would have been able to access. So it's not only that we have these sorts of benefits, that we have the accompanying services like VITA services, these free tax prep services that exist to be able to make sure that we are creating awareness and education about that these credits exist and how powerful these credits can in fact be to individuals. And I think that's one of the most important call outs that I want to make. And while it's not on any of my slides, is that we know that while the earned income tax credit is a powerful tool, and we've seen this on with what all of my colleagues have said, we've seen the impacts. We know what it can do. But even though knowing those impacts, there is still a substantial number of people in our country who are not actually getting these benefits either. And it's not just because of what's going on state levels, but it's just because of the lack of awareness or actually being able to engage in services that will allow them to access it. Case in point, there was a 2022 research study done by the Chicago Fed that kind of gave a range on what they estimated was lost EITC, or rather unclaimed EITC benefits on the federal level for the tax year of 2019. And on the low end, there was an estimation that perhaps anywhere from 25% of all American families, which is about 7.5 million individuals, did not access it, even though they were eligible for it, with a minimum of potentially $4 billion, billion in earned income tax credits that went unclaimed, with a top end of possibly being as high as $11 billion. So imagine what those dollars could have done for those families, those 7.5 million families that were either unaware or didn't think they were eligible, or just didn't file a tax return, either because it was not accessible or it was not within their economic range to be able to do it. So there's a lot of work that we can do on this front. But most importantly, in all of our conversations today, it's about what the benefit is, not only for individuals on the federal level, but how this can also affect individuals when it comes back down to the state level. And if we would, Travis, you can go ahead and go to my final slide, is that I'm just reiterating a lot what a lot of my colleagues have already said here. Mike and Paris's story really shows how impactful that EITC can be. $5,000 back is a major influx of dollars into that family's annual budget. And that all came from the federal level because it is refundable. Unfortunately, again, as we've already said, Ohio is one of those states that has a non-refundable. It is the portion that helps to reduce the taxes, but does not actually put money back into people's hands. And it's the refundability element that drives a lot of these things, these results that Travis and Alex have mentioned about improvement in health, better participation in school, better educational outcomes. It's due to the refundability factor that really drives a lot of those results, and why the federal refundable EITC has been so impactful in driving down childhood poverty, reducing childhood poverty quite substantially since the years of 1993 all the way till today. It's driven down childhood poverty by the millions, and that's because of the refundable element. So when we think about the earned income tax credit, along with the child tax credit, we need to be thinking about what we're doing in terms of advocacy and the power it can have by converting it from this non-refundable credit to a fully refundable credit, and the benefits that it can have to the families in our community. And with that, I'm just going to end and keep it brief that with free tax prep, we are always looking for individuals to come and lend a hand, because at the end of the day, one of the most important things about the earned income tax credit is you can only access it by filing your tax return. And so the more individuals who are aware, and the more individuals that we have to be able to help us help and work with other Ohioans, Kentuckians, or Hoosiers to be able to get their tax returns done, the greater chance we have about connecting these individuals to earned income tax credits. So with that, Holly, I'll just kick it back over to you so that way we have plenty of time for questions.
Thank you, everyone. This is such great information. I'm not Holly, but I'll go ahead and I'll moderate some of the Q&A that had some questions pop in directly to me. And actually, I think that we can probably stop the share of this for now. Matt, I'll ask you a question first. I'm thinking about some of the efforts that states are encouraging individuals to learn more about their eligibility for EITCs. And you kind of touched on this, like you can't file for it if you don't know that it's there. Lots of eligible folks might not know they could receive the EITC. And wondering if you have any thoughts about how we can better inform individuals, or can employers themselves help in this regard? Do you have any thoughts on that?
Oh, 100%. And I would get right to the point that you just made. Obviously, the more that we can have employers engaged in this work, the better it would be, because oftentimes having refundable tax credits is, as you've already indicated, it parlays into maintaining workforces. So there's an incentive not only just for the individual family to get this and the boon that it provides to the families, but then that in turn has a boon for everything else that wraps around it, which includes health as well as employability, or rather the retention of employment. I think one of the biggest, I would say that this is an outstanding issue, though, about awareness. We do tend to know that some of the individuals that do not claim the earned income tax credit do tend to be some of the lowest brackets of income. And there are theories and kind of, if you will, assumptions from anywhere from, whether or not there is a lack of just, I didn't know that this existed, to whether or not there are trust factors as well. And that's why programs, I think, like United Way and any VITA program, I should say, for that matter, across the country are so vitally, I didn't mean to pun, but so vitally important there, because I think it's really about trust. There's a lot of trust there that occurs because you're having an individual go into someone that maybe they've never met before, and they're exposing themselves in a way that some of us don't do on a day-to-day basis. Like, here's all my information about who I am and who I am financially. That takes a lot of trust and a lot of kind of, I will say, kind of guts on people to be able to kind of take that bold step to go forward to say, I need to get this done and I need to have access to it. So, but where am I going to turn to? And unfortunately, as good of the work that VITA providers do in this space around tax preparation, there are also some bad actors out there as well, that we know that scams exist and that people sometimes do get taken advantage of. So it's really about trying to find that trusted entity that you can go to be able to get your taxes done, and taking that sort of chance, if you will, because I think that there is that sometimes that fear about, am I going to owe something? Or what if somebody gets my information? And so I think it's about those educational pieces and continuing what I think all of us do here in this space, and that's educating around this benefit is worth it to be able to take that and to go and get your taxes filed.
Thank you. Thank you so much. Alex, I have a question here for you. As you've been working with different states and tracking state, shifting in terms of these policies, in the states that have successfully passed refundable EITCs, what was some of the messaging around that switch that really resonated with policymakers themselves?
Yeah, I think, the earned income tax credit, as you said, I think Holly at the beginning, is really unique in its bipartisan support. And I think it's a lot of the messaging around, you get a larger credit the more you earn. It is, encouraging work. There's really just, and then like the rich evidence base behind it, right? That these benefits are seen and they're sustained over the long term, right? Like it allows people to enter the workforce and stay in it. It reduces reliance on the public safety net. And then also, especially like around how that money returns into the local economy is also really helpful for messaging with businesses.
Yeah, great.
And we've also just seen states, right? Like it's kind of like a once you have it, like the expansions seem to be, manageable, right? So it's kind of, taking those incremental steps, right? So I think for Ohio, this like moving from a non-refundable to refundable is really key.
Yeah, thank you. And, Ohio has shifted. We had a smaller non-refundable credit, and it has also expanded several times. But I don't know how much of that expansion has really put more money into the hands of a lot of Ohioans. So, yes, thank you. I think maybe both of you could respond to this one. Maybe Alex, we'll start with you since you're unmuted already. How should we think about the differences between the EITC and child tax credit and their impact on families?
Yeah, that's a great question. When I showed that timeline of how long the EITC has been around, right? So we have all this evidence of its effectiveness. Child tax credits are a much newer thing, right? They really have only been around in the 2000s. They also used to be very modest, like $100 or $200. And so these more generous child tax credits, like we're seeing in Minnesota, are really a newer thing. So it's hard to speak to their effectiveness in states. But we've just been encouraging states to be sure they're thinking about their tax code really holistically, right? So thinking about the tax floor, like at what point do households start paying taxes? What is your tax rate in your lowest bracket? What is your deduction? How does the EITC and the CTC really stack on? And I think that is why the work you're doing on the benefit cliffs is so important in that graph you showed, right? Because it really shows what is the effect of every dollar on these families.
Yeah. Alex, Matt, do you have any thoughts about EITC versus child tax credit or?
So the only thing that I would offer is clarity. So we focused on earned income tax credit. So hopefully you've taken away that one of the main qualifiers is that you are earning an income. That's one of the primary drivers of qualification. And then by having children, that kind of is like your multiplier, if you will. CTC is really focused on if you are a caregiver of a child, usually under the age of 18. And so while I would very much agree with what Alex said in terms of this is one of the newer credits that exists, so it doesn't have that sort of longevity to be able to prove the same sort of effectiveness. However, we do know the measures of the effect of the, if you will say, the kind of pandemic era CTC benefits that many people qualified for, including myself, having 2 children, that provided a lot of dollars into my hands. And one of the main mechanisms or one of the main functions of providing a child tax credit is really to help those families that have children, because children cost money. Paying for childcare is one of the most substantial costs in any family budget, including my family budget. And so this is just another opportunity, again, to be able to put dollars into people's hands to be able to account for all of those expenses, the rising costs of childcare, the rising costs of everything. to be able to kind of make families be able to make ends meet as best as possible.
Yeah, thank you. I think we have time for one or two more, and I'll pose this to both of you. Although this might be kind of more suited towards an individual level rather than a statewide level. We've kind of hovered around this a little bit, thinking about what would individuals do with an extra, $200, right? I mean, I think to a lot of people, a one-time one-time recipient of $200 doesn't seem like a lot, in the grand scheme of things. When we're talking about lifting people out of poverty, what are some of the practical ways that families talk about, like, what would you do with an extra $200, for your family? What does that mean to you? How, do you, I guess, Matthew, maybe I'll start with you on this one. Have you kind of worked with individuals and with families maybe more closely? Do you have any other examples in your work?
Oh, of course. So I would caveat that with, so I would always look at it, what it could do when we have it from the state and the federal, because then that's what the whole pool would look like. And as I gave it the example in Mikey and Paris's, that was $5,000. Now that's probably getting towards sort of the top end, because I believe the average is more akin to about $1,500, if I'm not mistaken. But again, the number one reason most people call United Way's 211 helpline, which I'm sitting adjacent to right now, is for things such as rent, utilities, and then usually food. So $1,500 is in many cases a minimum of 1 to 1.5 or maybe even 2 months of rent. It is usually going to amount to anywhere between 3 to 4 months worth of utility bills. I'm not sure how food is not my expertise, but I'm sure that would cover at least 2 months worth of food resources. But I think it's not so much of thinking about it in isolation of like, what does that just do in that moment? Because we know that everything has a cumulative effect. So it's by either reducing something or being able to build something up over time. So for instance, thinking about, well, that $200, let's say that, we're doing okay and that's not really filling anything. Maybe that's the opportunity to start investing in your child's future education through maybe some sort of savings plan, like a 529. And we know that with 529s, those sorts of investments at early ages and then done year over year basically raise it makes that post-secondary very much accomplishable, and it is a proven trajectory to being able to get people into high-paying jobs and things of this nature. So it's not just thinking about what it could relieve, but it's also thinking about what could it also like supplement towards in the future. So I think that we don't want to just view it in isolation as the $200, but what is that total package, and how would that total package, if it didn't exist, what would that accumulate to? Again, I think of rent because I am in housing. It's like with one slip of $200, then that starts building. And as that starts breaking down, the other elements of our social determinants, from health, from school attendance, all of that can also start breaking down. So I don't want to view it as just that piece, but it's cumulatively going towards securing something so that other things can be secured in the social determinants of health spectrum as well. So
Yeah,
hopefully that was a good answer, Travis.
Yeah, no, I appreciate that, kind of taking a step back and looking at the big picture there. And I think a lot of people can relate with that, right? Increasing costs of housing, food, utility bills. So I think that, even in the moment, it can alleviate a lot of stress and pressure, and thinking about that long term is great too. Alex, do you want to add anything to that real briefly?
No, I think, Matthew, you covered everything. I mean, it's just really a big system of care for these families, right? Not one policy is going to do everything for them, but that $200 is critical. And, the research overwhelmingly suggests that families invested in their children, pay down debt, pay ahead on rent, utilities, and things like that. So it's just very crucial for families. And thank you for the great work you're all doing.
Yeah. Thank you both for being here. That's all the time we have for today's event. But I really think that this has been such a great discussion, thinking about kind of statewide, very broad kinds of policies, and looking really specific at individual families. It's a really great kind of complementary relationship there. I want to thank especially, everyone who has attended, but particularly, Alexandra Heralampudis from Prenatal-to-3 Policy Impact Center and Matthew Long from the United Way of Greater Cincinnati for weighing in on this topic. And everyone who was registered for today's event will receive a follow-up email with a copy of this webinar, slides, and a link to our full report from the Women's Fund, or you can kind of find that on our website, cincinnatiwomen'sfund.org. And so if you'd like also, while you're on our website, sign up for our newsletter to stay in touch with us and hear about more events like this in the future. I'd like to thank you all and enjoy the rest of your day.